Let's take a look at some of these elements around prescribing medicine. So the title of this is Deprescribing: How Building Lean Muscle Can Eliminate Medication. And I'm going to pause here for a minute so that those of you who want to can screenshot this. But let's just take a look at comparatively how exercise compares to medication. So in this case, the drugs for diabetes, the insulin sensitizers, metformin and TZDs. So how muscle mimics or surpasses it. Muscle, contracting muscle translocates GLUT4. What is GLUT4? It's the doorway on the surface of your cells that allows glucose to come into the muscle so that you can make energy. Muscle also releases interleukin-6, irisin, and myonectin. These all improve glucose uptake and hepatic fat burn. So they prevent your liver from becoming fatty. Moderate exercise outperformed 1 gram a day of metformin for insulin resistance in prediabetes. This was a meta-analysis done that showed that HIIT training, the HIIT training is an acronym for high intensity interval training, and resistance training boosts insulin sensitivity similar to metformin doses. So what we're saying here is that exercise outperforms this because this costs money. Exercise doesn't. What else does this cost? This costs nutrients. It costs side effects, right? So one of the things we know, for example, metformin does is it causes B12, folate, and CoQ10 deficiencies. What happens when your B12 and folate are deficient? You have an increased risk of heart disease because these two B vitamins control a heart disease chemical called homocysteine. What happens when CoQ10 is depleted? Your blood pressure goes up. You can develop neuropathy. You can develop myopathy or muscle pain. CoQ10 deficiency can cause congestive heart failure. So, I mean, you're treating a disease that exercise could treat equally and effectively, but the cost of that treatment, beyond the financial cost, is to create malnutrition in the host that leads to the very disease that you're trying to prevent. Then we have antihypertensive drugs, the ACE inhibitors, the beta blockers, the angiotensin receptor blockers. So let's look at exercise. Isometric heavy eccentric lifts enhance endothelial nitric oxide, reduce sympathetic tone, and remodel arterial stiffness. So they basically make your blood vessels work better and dilate better. We know that resistance training cuts systolic blood pressure by 8 points. That's the top number. Comparable to first-line drugs, meaning it's comparable to these drugs. These drugs can lower your blood pressure by 8 to 10 points. Exercise, same thing. But again, you don't get the side effects.